Hi, my name is Jay Iyengar and I'm an orthopedic surgeon. Today we're going to discuss shoulder replacement surgery. There's two kinds of patients that can benefit from a shoulder replacement. People with advanced arthritis of the shoulder or people with severe rotator cuff disease and weakness and pain from muscle degeneration. There's two main approaches to shoulder replacement surgery. A standard shoulder replacement is used for patients with wear and tear arthritis of the shoulder joint, and a reverse shoulder replacement is used for patients with additional rotator cuff damage as well. So typically patients are going to have a lot of pain symptoms, and when they have difficulty lifting their arm overhead for simple movements, that's usually an indicator. And when they're no longer responding to treatments such as physical therapy or cortisone injections, it is time to consider surgery. Computer-navigated GPS surgery is definitely the state of the art right now in terms of joint replacements. And for shoulder replacement surgery, as we discussed, it's very sensitive to accurate and precise placement of the components. And so this allows you to get precise placement every time, individual to the patient's anatomy. In terms of GPS-guided technology, there's very few physicians in Northern California using it, and we're the only center in the Central Valley that offers this technology.